lot of you saw the video that I made where I was gloating over my first harvest of honey. I started beekeeping in 2017, and that was the same year that the FDA underlined in its Veterinary Feed Directive that any livestock that was being given antimicrobials had to be under the direct supervision of a veterinarian, and that veterinarian had to have a valid client-patient relationship with the person that was in charge of the livestock. So a lot of veterinary professionals were surprised to discover that bees were covered under that directive. So with me today is Dr. Chris Cripps. He is a veterinarian. He's an experienced beekeeper, and he also owns Better Bee, which provides bee supplies to all the beekeepers in America. So he's going to talk a little bit more about this directive, tell us where we are as an industry with it. So Dr. Cripps, welcome. Thank you so much for doing this for us. So bees are livestock, huh?
Thanks for having me, Bash. Bees are certainly livestock, and that's something that the FDA has said, you know, we need to have prescriptions, we need to have veterinary feed directives if we're going to use antibiotics with them. You know, they have a whole presidential edict to keep antibiotic use under control so that we don't have resistance develop amongst bacteria to antibiotics. And because of that, they've changed the rules, and bees have come along with the you know, the cows and the sheep and the goats.
Is it really, are you really concerned that much for antibiotic resistance being created by bees that are given antibiotics? Are you, as a veterinarian, concerned about that, or do you think that concern might be a bit overblown?
We worry about that a lot because the resistance can be transferred from one bacteria to another, and they don't necessarily need to be the pathogens. So we could have other bacteria being exposed to the antibiotics, and then they could pass that resistance gene on to the pathogens that we're worried about. So there is some concern there. I don't think that honeybees were the point of what the FDA did. I don't know that the FDA even realized that honeybees were going to be dragged along here. I think this was kind of an afterthought. Honeybees are they're a dot on the whole graph of antibiotic use for animals. You know, it's a very, very, very small part.
What were beekeepers doing before the directive with their bees and their use of antibiotics?
Yeah, so before the directive, antibiotics were available over the counter. So the beekeepers made the decision, do I need antibiotics or not? And then they would apply the antibiotics as they saw fit. The directions on the package should have been sufficient, you know, to tell the beekeeper how to mix up the antibiotics and use them, you know, but the whole discussion of do I need it or not was up to the beekeeper. There are a lot of books that say you should treat your bees with antibiotics twice a year. And what they're looking to do is prevent clinical signs of American foul brood. American foul brood is a spore-forming bacteria that creates sickness in bees that will actually you know, wipe them out in the course of the year. Highly contagious to other bees in the area. So up to, you know, 2 or 3 miles away where the bees would fly, you know, if my bees are sick with this disease, other bees a couple miles away could come, steal all the honey, get the disease, and carry it back to their hive. So people would give antibiotics, you know, prophylactically to try to prevent that disease from showing its signs. And now there's another disease that we've also been worried about called European foul brood, which doesn't create the spores. But in order to really get better, a lot of these cases require antibiotics. When I go to beekeeper talks and talk to the beekeepers, there's very few of the backyard beekeeper that has, you know, 1 to 10 hives that has ever used antibiotics. But when you start talking to people who have been at it for a long time, they have used antibiotics because that's what the books taught the beekeepers for a long time, was that this was required. A lot of people are finding now it's not really required every year. You know, it's not really required at all. So a lot of beekeepers aren't even doing any treatments, and they're doing fine with their bees.
So I want to get this straight. As a beekeeper, I'm giving antibiotics prophylactically to the bees, and then the bacteria in the bees are slowly developing resistance to that antibiotic, and then they're passing that resistance on to other bacteria. Is that how it works?
That's basically how it would work. So the bees don't become resistant to the antibiotics. The bacteria become resistant to the antibiotics, and we've seen cases of that where the bacteria that cause American foul brood have become resistant to oxytetracycline. That's the antibiotic that the beekeepers used for a long time. So the USDA actually went through the trouble of getting tylosin approved to be used for honeybees, to have that as an alternative when we had bacteria that were resistant to oxytetracycline. So we have seen in the beekeeping world, we have seen resistance amongst the bacteria to the antibiotics that we had available, and then the theoretical thought process is, that resistance could get passed on to other bacteria as well and help them become resistant to that antibiotic.